Obesity is a really complicated space. No one thing is going to fix it.
One in 4 children in Australia are affected by overweight or obesity at the time that they start school. Obesity is associated with a range of health issues. Of course, as you get older, the health issues become more profound, but even in young children aged 3 to 5, those with obesity are more than 1.5 times as likely to end up going to hospital and to having an operation compared with those of healthy weight. Our group is really interested in, can we try to turn things around by starting in those first few years of life? Generally, people tend to work in their own research groups, my silo, your silo. What we've done with EPOCH is to try to bring people together in a collaborative approach. We've deliberately organised streams of work with people working across universities and across states.
Measuring obesity-related behaviours in young children is a really crucial part of obesity prevention efforts. We found that really there was no fit-for-purpose tools out there, not in Australia or even internationally. And the tools that were available either only looked at diet or activity alone, and also they could be very burdensome, they would be very long. The tool that we've developed is as simple as 10 questions, and it takes less than 5 minutes for caregivers to use.
The primary aim in our stream was to be able to do economic evaluation of interventions to prevent obesity in early childhood. You can actually evaluate lots of interventions, and the idea really is that we can look at what is the best value for money. So we never have enough money for prevention, and to use money wisely, we really would want to use it to fund those interventions that actually give you the best benefit for the money spent. So it's all about value for money.
It's interesting bringing together people from very different backgrounds to listen to and learn from health economists, really amazing statisticians, health promotion practitioners, people who are experts in the measurement of physical activity or nutrition in childhood, people who work with culturally and linguistically diverse populations, people who actually think about how does policy get implemented and how do we resource that in a state government department, and learn about that. And we can't do our work in early childhood unless we have that diverse range of skills.
The states and territories are quite committed to act in this space, and so they have collectively tried to develop the National Obesity Strategy, really without a lot of input from the Commonwealth. Overarching policy really does drive change, and it's really important to have that structure in place. What we don't do so well is look at those upstream determinants of health, and so things like considerations for the food environments and the physical activity environments, we have a lot of potential to do better. I think when it comes to children, the public are a lot more supportive of policies that are going to be helpful for children.
Part of the EPOCH CRE Stream 4, we've been focusing on 2 different evidence-based programs. One of them is Infant, which is implemented in Victoria, and the second program is Healthy Beginnings, implemented in New South Wales. Some of the key findings that we found is that it is feasible to integrate and deliver these programs within existing services, because the clinicians that are working in maternal and child health have found that this is part of their core business. They are already delivering this kind of information, but it had provided them with further support. It's exciting to see that both programs are being scaled up within each state, but also with the intention of implementing them on a national scale.
The World Health Organization, in its Ending Childhood Obesity Commission, made tackling obesity in that very first couple of years one of its major strategies. And one of the pieces of evidence that they used is the work that has come from the EPOCH group. That was so exciting. We've got a collaboration that's going internationally where people have agreed to share their data from obesity prevention trials around the world so that we can better understand what aspects of which interventions work best for different people in early childhood. It's been wonderful to see the new opportunities coming out, the ability to see interventions being implemented, particularly in New South Wales and Victoria. That's so great, seeing those become part of routine practice.